and blessed good afternoon, and welcome back to those of you continuing in your second semester of 2021. I'm Kathy Rock, and today I am going to be sharing with you on how to navigate in this new environment that we're in, this new COVID-19 pandemic. So today's topic will be your health, COVID-19, and you. As a reminder, as Barbados and the rest of the world continues to navigate this new environment, the BCC and the Barbados Community College Student Health Clinic is committed to bring health and wellness to the forefront, and more importantly, to keep you up to date with all the health services information and resources and how you can best manage the pandemic during your studies here with us. By now, most of you would know that COVID-19 is a contagious illness. It spreads primarily from person to person through droplet secretions being released by an infected person into the atmosphere when that person sneezes, coughs, when that person sings, for instance, or if others are in contact with that infected person through direct contact when hugging, shaking hands, kissing, or in the very near vicinity of an individual when they release these droplet secretions into the atmosphere, into the environment, or if they come in contact on surfaces that they have released these secretions onto. As you may know, as we travel throughout our environments from time to time, we will be in contact with hard surfaces, soft surfaces. Most of us, if not all of us now, have digital devices, be it our technological aids, or laptops, or tablets, or cell phones. And these two are surfaces and areas that can be easily contaminated when someone touches those surfaces, or again, if those surfaces were previously used by others who are infected. So special attention must also be made when we come into contact with these surfaces in our environment, whether it's on campus, whether it's in going about our business in the supermarkets, touching surfaces like doors and doorknobs. Be mindful of sharing things like pens and writing equipment, those things, or even instruments used in things like laboratories or within our workstations or at our work, in our work environments or labs. So what do we understand about SARS-CoV-2? SARS being the respiratory syndrome. It's a new coronavirus, as many of us will know, and it causes COVID-19. It's characterized by thick mucus being produced, and this mucus obstructs the airways and obstructs the lungs, therefore making it less effective for an individual to breathe efficiently. It's a highly contagious virus, and it is usually, if a person comes into contact with the infected person, within the first 5 days of contracting that illness, is usually considered to be the most infectious time, and that's when symptoms are likely to appear. Now, some people may be asymptomatic, meaning they show no signs and symptoms, and this is why our precautions and our protocols are very important. We do also know that persons with comorbidities, be it the elderly, be it persons who have pre-existing medical conditions, respiratory conditions, so persons with asthma, diabetes, heart disease, and other immune or autoimmune conditions, cancer, should also be very aware. And we, or other individuals around such persons, should recognize that these persons are vulnerable and they appear to have more severe presentations, meaning that they can become ill a lot faster or their condition can deteriorate rather quickly. So it's important for others who may be asymptomatic but infected and can unknowingly spread the disease, that they put all measures in place and ensure that they're following the protocols to limit the spread of this infection. We do know too that the pH of this virus ranges somewhere between 5.5 to 8.5, and that's important. We'll see why a little bit later. And that there are new variants which are seemingly more easily transmissible. What that means is that these new mutations or changes in the virus is easier to transmit than the COVID-19 that we first heard about in early December, January, late December to 2019, January 2020. We do know also that breaking the chain of transmission is one of the major ways in which we can prevent the spread of COVID-19. So here are some common signs and symptoms to be aware of: high fever and chills, dry cough, and this is usually a dry cough not present previously, difficulty breathing, which some may call shortness of breath. Some transient or more subtle symptoms may be things like fatigue, muscle or body aches, headaches, a new loss of taste or smell, and this is one of the primary signs and symptoms that some people are complaining of. They recognize that they can no longer smell, or for a couple of days they can't taste anything at all. Sore throat, congestion or runny nose, and sometimes this may also be similar to what people experience where they're having like a postnasal drip. Nausea and vomiting and diarrhea. Now, these are all the common signs and symptoms that persons would have or could previously have experienced with the common cold or flu. So be mindful that when these symptoms become worse or are for prolonged periods of time or have lasted within 3 to 5 days, then you know that you may need to seek medical intervention or you may need to seek medical advice. For the severe infection, symptoms may include, but they're not limited only to these: trouble breathing, a persistent pain or pressure in the chest, new confusion. So the person may have either been quite alert and oriented, and all of a sudden you find that they're having difficulty breathing, trouble breathing, and the individual lapses into periods where they are less oriented or very confused. Inability to wake or stay awake, bluish lips or face, or this is called cyanosis, may indicate that this person may be oxygen deprived and their condition can deteriorate very, very quickly. So it's important that medical attention is sought. Individuals can call the COVID-19 hotline at 536-4500, or in severe cases, they may also call the QEH COVID-19 help desk at 536-4800. It's important that you share what was occurring. You may be required to state whether you've been in contact with a known or suspected case of COVID-19, and the health care professionals on the other end of the line will give you information on how you may need to proceed. It's at that point in time you may need to ask for a test, but again, this may be dependent on what level of contact they may have stated that you may be in or probably be in. Now, it's also important to understand the incubation period of COVID-19. And this period, which is the period from the time of exposure to the time where symptoms or the onset of symptoms may exist. And this is important because on average, it takes about 5 to 6 days for symptoms to present. But remember, we said earlier that some people may be asymptomatic, but in some cases, it can take as long as 14 days for people to present with symptoms. So if a person knows that they have been in contact with someone who may have been suspected or confirmed to be COVID-19 positive, they should contact the authorities. They will need to quarantine, and this is important to limit the spread. Ensure that you're following the Ministry of Health and Wellness's protocol for quarantining with respect to the different contact levels. So if you're primary, secondary, or tertiary contact, and this information will be shared a little bit later. So according to the Ministry of Health and Wellness, a primary contact are those persons who are categorized as being primary contacts are persons who come into direct contact with persons who test positive for COVID-19. A direct contact in a COVID-19 context, is a face-to-face interaction with an individual within 2 meters and for more than 15 minutes without a face mask. Let me repeat that. A primary contact are persons who come into direct contact with persons who test positive for COVID-19. And in this context, they must be a face-to-face interaction with that individual within 2 meters or less, within 2 meters, and for more than 15 minutes without a face mask. A secondary contact, on the other hand, these contacts are persons who have direct contact with primary contacts. For example, if you are a worker from a household with a known positive contact and you go to work in an environment and you interact with your co-workers, then all those persons, along with yourself, are considered secondary contacts. A tertiary contact, on the other hand, may be considered a person who interacts with a secondary contact. The tertiary contact is therefore the furthest removed from the index case or the primary contact. And this is according to the Ministry of Health and Wellness. So it's important to note that because it may allay some fears and will help persons to categorize you when you seek medical attention. To slow the spread, the major concern of public health is to be able to contain the spread of the virus. It is therefore critical to focus on persons who were exposed within the first 5 days to a person who is positive. And remember, we said that's important because you want to care and treat for those persons. And remember that this is perhaps the most infectious time that an individual may also be, and you're trying to limit their interaction with others. The second consideration is whether that person is classified as a primary, secondary, or tertiary contact. And this is important to allow focus on the patients who are primary contacts so that they can get into care or be isolated quite early, and especially when exhibiting symptoms. All primary contacts should present themselves for testing at a designated testing site, and we're going to share some of those sites a little bit later as well. So what's the difference between quarantine and isolation? Quarantine represents restricting the movement of people, and this is to limit the spread of disease, and it is used to keep someone who might have been exposed or suspected to be COVID-19 positive away from others. This helps to limit the spread, especially if the person knows they're sick or if they are infected with the virus without having symptoms, meaning they're asymptomatic, or if they are awaiting test results. Isolation, on the other hand, is an infection control measure which prevents this communicable disease from being transmitted from an infected person to the other. So the person is known to be infected or tested positive for COVID-19, and you're isolating them from others, from those persons who are likely to be uninfected. It involves the separation of sick persons or those infected who have tested positive and are exhibiting symptoms from persons who are not ill. And it allows those ill persons to also be monitored, be cared for, and treated. So all of these strategies are aimed to first identify suspected cases as quickly as possible, to test and isolate all cases or persons who are infected, and place those individuals in appropriate facilities. Additionally, the public health authorities are also trying to identify and quarantine all close contacts of infected people and test those who develop symptoms so that they can be isolated if they're infected and require care. So it's important to know why we're doing what we are doing. Now, according to the WHO, a comprehensive prevention strategy or measures will include the following. Frequent hand washing. Hand washing should be done for at least 20 seconds. Some people say sing the happy birthday song twice, or some people may say the ABCs, but 20 seconds is needed. And hand washing, the steps briefly: you wet the hands under running water, you soak the hands, and you can use liquid soap. Liquid soap is preferred. You rub the hands together. You rub the interlaced fingers from the front of one hand to the other. You interlock these fingers and you rub the back of the fingers of both hands. You're going to rub the palm of each hand for 20 seconds. Don't forget your thumbs, your wrists, and you rinse. All contact surfaces of the hand should be washed. Remember, behind the interlaced fingers, you will actually get the nails, but you try to keep your nails also short and under them clean. And you dry it in a paper towel, preferably. Face mask, second prevention measure, and this should be worn when in public or when quarantining at home. The correct way to put this face mask on is by using the tabs or ties. And this is how you will don it. And it should cover the nose and mouth. You're wearing a face mask and it's not covering those two orifices, you will not have the best protection, and you run the risk of not only, if you're infected, allowing that infection to spread to others as you breathe, if it's only covering your mouth, but you also run the risk of being infected yourself if you're not social distancing well or you're in close contact with someone who may be infected. Remember, this is droplet secretions that may be circulating in the atmosphere where there are lots of persons around. And if one person is infected and not necessarily following the safety protocols, and you are also not doing so, you run the risk of also becoming infected. Physical distancing when possible. At all practicable times, physical distancing is 6 feet away from others, and that's at arm's length. So, and this is wherever possible. So it must be used hand in hand with the wearing of face masks. Respiratory etiquette is also important. So if persons are exhibiting signs or they're going to sneeze or cough, you want to do that in tissue, not with bare hands. And I know this is a reflex, so should it occur and you weren't able to get that arm up quickly, or you use your hands and you didn't have tissue, you need to wash your hands immediately. Okay? Failing that, the correct way is to use the flex or bent elbow to sneeze into or cough into, or preferably a tissue, and then dispose of that and sanitize the hands again. Environmental cleaning and disinfection is also important and crucial, and the recommended precautions of avoiding crowded areas, or more importantly, physical distance or social distancing when in a crowded area, and ensuring that you have good environmental ventilation in a closed setting is crucial. According to the WHO, masks should be used as a part of a comprehensive strategy of measures to suppress transmission and save lives. The use of a mask alone is not sufficient to provide an adequate level of protection against COVID-19. If COVID-19, as it is spreading in our community, because now we have community spread, stay safe by taking some simple precautions, which we've mentioned earlier, such as physical distancing of 6 feet or more, wearing a mask, keeping rooms well ventilated, avoiding crowds, cleaning your hands, and coughing into a bent elbow or tissue. Do them all. Wearing a mask is a normal part now of being around other people. It's also important to know how to appropriately use, store, clean, and dispose of masks as effective ways to limit the spread or transmission of COVID-19. So some persons may ask, do masks really help prevent coronavirus spread? And the answer is a resounding yes. Masks are an effective way for containing the spread of the virus, along with social distancing or staying 6 feet apart from others, and again, washing the hands. Or even for the persons who may not be ill at that point in time or exhibiting symptoms, when healthy people wear masks over their mouths and nose when venturing out of their homes, it limits the spread of SARS-CoV-2, and it limits the spread of persons becoming infected by this virus. So masks are very important. This is a short, quick video which shows why a fabric mask in particular is essential, as it limits the spread by containing viral particles or secretions when someone coughs, talks, or speaks. So just listen for a minute. Okay, so this video clearly showed that by using a stitch fabric cloth mask or fabric or cloth mask or a disposable non-medical mask, you pretty much limit the spread by ensuring that those secretions or droplets as you breathe, talk, speak, or sing will be contained. And these cloth masks are efficient by limiting the spread up to 2.5 inches from the face. You would have seen bandanas as well as the folded cloth masks which were not stitched had varying degrees in terms of distance. So that was a good representation to show that the importance of wearing these face masks, these stitch or handmade face masks. How to wear a mask, we demonstrated that earlier, but be mindful. When you're wearing the mask, it should cover the nose, again, the mouth, but it should fit snug to offer the best protection, and it should cover under the chin. Make sure that you wash your hands before you put on the mask, and more importantly, when it comes to removing that mask, that you're also washing your hands after you've removed the mask. Do not touch the mask in the contaminated, lightly contaminated space, which will be on the outer surface of the mask. So you don't want to be handling this area. And if you do, you need to wash your hands or sanitize. More importantly, you would also ensure that you change that mask if it's moist, if it's soiled, and after being in a crowd for extended periods of time. Masks that have been used can be easily stored in a plastic bag or paper bag until they can be laundered for those facial masks and properly disposed of in the garbage disposal unit if they are disposable masks. Remember to wash your hands and wash your fabric mask after use. At the Barbados Community College, we will be following strict COVID-19 protocols to ensure that we all are remaining safe. So please, if you're going to do any business, you have any classes, labs, or so, as we were doing in late March of 2020, you will be required to mask up while you are on campus at all times. Do not choose a mask that have these exhalation valves because they would allow virus particles to be emitted in the atmosphere. Also, be mindful that you want to have breathable fabric, so preferably natural fibers for the masks that you choose. So cotton masks are important. And please leave those masks that are for our frontline workers who may be directly involved with persons who are COVID-19 positive. Those N95, KN95, and surgical masks, leave those masks for those so that the availability for our healthcare workers and our frontline workers, that they will have access to these masks. Ensure, again, that there are no gaps while you're wearing the mask. If there are gaps or the mask is too big, it will not offer you the same or effective protection. Always wear a mask when you're leaving home, again, or in a crowded area or in close contact with others. And this may also be persons within your home who may also be quarantining or awaiting a result. So if that's the case and this person is, say, a secondary contact or likely tertiary contact, it will be advisable until that result is known, if they have been screened, for you to be wearing masks. Do not use it when you're at home alone, obviously, unless you yourself are self-quarantining and you don't want to contaminate surfaces and so on. And avoid wearing the mask while you're traveling, say like in your vehicle alone. But if you're traveling with others, and especially others not within your home bubble, you would want to minimize if the other conditions do not apply. So to slow the spread, we all must pay special attention and adhere to Barbados' laws and regulations and our health protocols to ensure our own well-being, but also the well-being of others within our environment. Follow government's mandates around travel, around work, and around you leaving your home. Always maintain your social distancing. Do not go to work or school if ill. So obviously right now we are in online teaching and learning mode. However, when we do come back for face-to-face or you have business to attend to here on campus, it's important that if you're ill or you've been in contact with or cared for a person known or suspected to be actively COVID-19 positive, that you not come to the compound. Inform your department or divisional head if the above applies. It's important that we consistently perform and follow all COVID-19 health and safety protocols as mandated by our government, as well as the BCC. When you're on campus, we expect that you will remain in your assigned office if you're a staff member, or space or department or division. So don't be traveling around to different offices. Report to your department if you have been contact traced or likely to have been a primary, secondary, or tertiary contact. So if you're at work or you're at school and you know that you have been contacted or you're likely to have been in contact with an index case or a primary contact, please let us know so we can help put others, let others who may have been in contact aware, and they too can be monitoring or go for tests as need or as warranted. Make sure that you give accurate information to authorities, and these are authorities here at the college or within the community, and that may be your name, your age, your contact numbers. If you're contacted by the Ministry of Health, the visits or places that you've been, your likely contacts and the dates. These are all essential for contact tracing. Remain calm, cooperative, but remain vigilant, and ensure that whatever you're doing, don't drop your guard. This is important to stay safe. We mentioned about avoiding the crowds and the poor ventilation, but also avoiding persons who may be exhibiting symptoms or may appear sick. So sometimes it may not necessarily be COVID, but it might be something else that could be contagious, because COVID does not eliminate the other respiratory infections or other illnesses that may be in the environment that are equally or can be contagious. All right. So be mindful that if persons are sneezing or coughing or whatever, you want to limit and take your distance. Avoid touching your face, eyes, nose, and mouth, and especially with unwashed hands. If your hands have not been sanitized or washed, then it is important for you to ensure that you are washing them before you touch them. We mentioned cover your sneeze and clean and disinfected surfaces. Be mindful that a national curfew has been extended from 9 to 5 a.m. until January 31st, 2021. And this may very well change. We don't know yet. But now that we have community spread, who knows, in a couple of days, this may all change. The purpose of curfew, however, is to restrict activity, movement, and gathering that can result in further spread of COVID-19. So to protect us all, stay at home if you're sick, wear your mask, do your own self-monitoring, monitor your temperature before leaving home, and it's important to have a thermometer at home. Wash your hands frequently for at least 20 seconds. Sanitize, 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 and especially before entering buildings, and I would dare say also leaving buildings. Practice your physical social distancing of 6 feet or more. Cover those sneezes and those coughs and dispose of tissue properly. Don't touch your face. If you're exhibiting symptoms or you're ill or you need to see your doctor, please call first before attending. If you are exhibiting symptoms that appear to be COVID-19, or you've been in contact with someone, you need to contact the COVID-19 hotline or the QEH help desk, depending on the severity of these symptoms. So here are some at-home health tips that I thought may be useful going forward. Don't panic. That's the first thing. Okay. You don't want to get too fearful. When we get anxious, we utilize cortisol is released into our system, and as a result, we find that we first of all don't think straight because that fight and flight mode comes all in sync. So remain calm, think things through, and then proceed with what is most plausible to ensure that you're managed quickly. Monitor those coughs, trouble breathing, or other respiratory infections, and you want to do your monitoring at home. And if you present with a fever, and that is a temperature above 38 degrees Celsius, then you know something is going on. It may not be COVID-19, but it's usually an indication that there's some infection going on and your immune system is trying to fight. Be mindful if your temperature is above 37.5 and you're going to an organization or you're coming to college, you will be rechecked. And if it's still elevated after a 3 to 5 minute period, you may be asked to, you will be denied entry, and you may be asked to return at a later date or to go get a health check. And if it persists to be elevated, you may need to call your doctor or your clinic, or more importantly, if there are other symptoms or you've been in contact, again, you may need to contact the COVID-19 hotline. Now, it's important that you boost your immune system, drink lots of water, keep hydrated, avoid the carbonated and the sugary drinks for right now, drink lots of warm drinks. Okay, remember we spoke about the temperature of COVID-19. Warm fluids will be things like your soups, your teas, and so on. When we flush, because apparently this virus also likes to, if it's in the buccal cavity or oral cavity, it will also go to your sinuses, etc. So there's a few things that may be helpful that you can actually utilize. Gargle with antiseptic and water, and this antiseptic can be a saline solution, salt water, warm salt water, or vinegar, solution, and you do that at least twice a day. Ensure that you're eating naturally unprocessed foods, and I consider these foods to be living foods. Those are the things that we cook for a little longer than the macaroni and elbows and catelli and all that. All right, so make sure that you're eating naturally unprocessed foods and lots of fresh fruits and vegetables that will give you the essential vitamins and minerals to boost your immune system. There are some supplements that are said to also help the immune response and boost your immune system. These will be things like zinc, your vitamin C, your vitamin D, and for early onset of illness, these vitamins may be warranted to give you a fighting chance to get over the illness as well. Natural immune supplements also may include things like turmeric, which is an anti-inflammatory. It's a tuber, almost orange tuber. Some people may know of it, and echinacea. And these also help to boost the immune system. Ensure that you're engaged in healthy activities. So again, you avoid the junk food or eating your junk food. Ensure that you're obtaining adequate sleep, because that helps your body to repair and your immune system to fight illnesses if you're well rested. Exercise, moderate exercise, low intensity exercise or medium intensity exercise, so walking or swimming and so on, may also be beneficial. Avoid alcohol and other substances that can depress the immune system and increase the stress response. That's important. So, the alcohol binges and drinking, remember, you want to stay away from those at this point in time or at all together. Engage others using technology, but ensure that when you're doing so, that you're not causing fear or that you're not sending misinformation, because then that can be detrimental to others who may be having a difficulty coping at this time. Make sure that you're maintaining a sense of well-being and purpose, and by all means remain positive. To maintain your mental health, because your mental health is equally as important as your physical health, engage in purposeful activities, and these may include your hobbies. So if you're at home, have breaks where you're engaged in something that makes you feel good. It may be reading a book, a leisure book, it may be meditation, it may be prayer. These are things that help us to release good endorphins and causes neurotransmitters that help with our mental and emotional well-being to be released. Manage your stress and avoid stressful situations and people whenever and wherever possible, because it's not always possible. But wherever possible, try to avoid them. And when you can't, try to adapt positively to these circumstances. Set realistic goals and manage your commitments to these. And these include those commitments to relationships. We recognize that persons are now at home, more people are at home, more people will be at home using similar devices or maybe at home in closer spaces, and sometimes friction may occur. So where possible, where you can hold your peace, as we often may say, you want to do so. Or if you can relocate to another area in the home where there's less interaction, then do so for your mental health and well-being. Find time to relax and rejuvenate. Reduce the screen hours and tap into nature. And I know when we first had the pandemic, you had the social media and the WhatsApp messages and everything was about COVID. And after a while, that can get to your mental health. So it's important that you tap into living and being positive and focusing on what is important and crucial, so that you remain self-aware and that you remain intact with life, okay? However, if you're overtly stressed or unable to cope with your current situation, it's important that you reach out for help. Call a trusted friend, or if it is severe and you are feeling overwhelmed, ensure that you reach out for professional medical care. Remember, as the clinic, will still be here for you. And there's also the Counseling and Placement Center for counseling. And there's also your public health clinics, the mental health clinics at your polyclinics that are still available and open, and you can make appointments there as well. So don't think that you're in it alone. Remember, the time to slow down is when you think you don't have time for it. So if you're feeling overwhelmed and you're feeling all rushed and all revved up, it might be time to slow down. So do it when your body says to do it. Remember, when you are out or you're leaving your home, practice your COVID-19 protocols at all times. This includes wearing a face or disposable face mask, in summary, sunglasses or a face shield. So this is a face shield. And there are others that may have covering at the top or a sponge at the top that will have a more concealed space. Immediately shower upon your return home and launder the clothing that you were out with. Rinse your mouth and your nose using saline rinses, and you can do that easily by using droplet secretions or something called a neti pot, or there's some nasal secretion, bottles where you can use your saline washes and you can irrigate the nostrils out. Or if you can get to the beach, then have a saline rinse that way as well. Also, you can perform steam inhalations at least twice a day. And steam inhalations is where you get a bowl of water, you cover your head in that bowl of water, and this is warm, hot water. You're going to be breathing in through the nostrils and out through the mouth. And this actually helps to clear your sinus passages, your maxillary, your nasal passages, helps to clear the the frontal sinuses and so on, because the sinus is like a sponge with little air pockets. So when they become plugged, or there's a collection of fluid, or like bacteria or viruses are collected in there, it can cause the infection. It can cause congestion. So you want to be rinsing as well as doing your steam inhalations. Those are important. You can use your shilling oil, your olivos oil, or you can use natural essential oils like orange oil, or things like the old people used to do, your orange rind, and you boil it and you inhale that. So you get those essential oils from those orange oils. You can also use things like your ginger and your garlic as well. And even for like sore throat, ginger is very good as for your teas and so on, but garlic equally. If you grate your garlic, you place that in some water. You can use either honey for taste or orange, and you drink that. That helps with irritation of the throat and for sore throats and so on. Practice your breathing exercises, and I'm going to demonstrate that in a few minutes, and ensure that you're washing and sanitizing surfaces frequently. So breathing is important, and as we said, this particular infection can also affect the lungs, as it can also affect other symptoms. But breathing is important so that we get oxygen around the body, so that we can keep our mental capacity and function well. But also remember, as our cardiovascular, our cardiopulmonary system works, it actually pushes blood as well as nutrients, as well as oxygen to the tissues and cells of the body. And that's what helps to keep us functioning and alive. So some self-helps and some useful items to have at home will be things like this for your self-monitoring. A thermometer. This is an infrared thermometer, but you can have an ordinary digital thermometer, would equally suffice to monitor your temperatures. They call a pulse oximeter. And our asthmatics, or those with respiratory illnesses, will know about this. And this can be found in most of our health stores like Collins and so on. You would want to put the finger on the pulse oximeter and you press, and it will give you a reading of what that individual's oxygen saturations should be. Now, oxygen saturation between 95, mine is now reading 98, and my pulse rate 85. Between 95 and 100 is normal. If that oxygen sat falls below 95%, then, and it stays within that range and you're breathless, you need to seek medical attention. Balloons are also important to help with breathing, and I'll demonstrate how. A firm straw and a glass or jug of water. Okay, so performing breathing exercises, you're breathing in through the nostrils and out through pierced lips. So in through the nostrils, and you're gonna, if you can think about drawing a box, for instance. So you're breathing in, one, you're making the box, 2, 3, and hold. So 1, 1, and that's important in helping to strengthen your diaphragms, your lungs, and the exhalation helps you to get rid of that CO2. Remember, as we are respiring, we breathe in oxygen, and we exhale or expire carbon dioxide. Another breathing exercise is by using a balloon. If you use a balloon and you think about blowing this balloon up in 3 goes, it helps to strengthen your tidal volume pretty much, or how you exhale. Okay, and that's important, and you can do that at least 3 to 5 times, and helping to strengthen your your lung capacity as well. I wouldn't advise it for if you're in severe respiratory distress, but practicing such before is important. And then for those persons who may also be blowing through a straw in some water, that also may be beneficial. Doing it frequently and helping to strengthen your lung capacity. Making sure that if you're having some breathing difficulty, you sit upright, or what we call a high fowler's position. And that's like when you're sitting in a chair and not slouching. Or when you're sleeping, sleep in the stomach, on the stomach in a prone position, and you can put a pillow under your chest area, and this helps for something called postural drainage. Postural drainage, what happens is that with this particular infection, you can get collection of fluid at the base of the lungs, or what we call the alveoli, those little air sacs at the bottom where oxygen exchange is taking place. So you're trying to drain any likelihood of inflammation or fluid until you can get medical help quickly. That also helps to facilitate your breathing, and more importantly, make sure that you're staying calm. So we went through all of these protective measures against COVID, and this is basically just a summary. It's important that we remember that this situation is still fluid, so things are going to be changing quite quickly. Remain current and ensure that you're obtaining credible information from national authorities. It's not the time to panic, but we need to make sure that we remember that this is a serious time. We must remain vigilant, we must remain cooperative, flexible, and stay engaged regarding our behaviors, the things that we are doing from day to day, and make sure that we're practicing these protocols at all times. While we take those steps within our community to take care of ourselves and for one another. So in brief, remember, as a student health clinic, we're still here for you, our college staff and students. We are here to offer confidential, student-friendly, and client-focused health services, albeit some of these services may very well be limited at this time, but we are offering consultations and health advice via our virtual telehealth portal, and our email for that is bcctelehealth@bcctl.edu.bb. Be mindful, if you're going to make a tele or virtual appointment, you may need to set that appointment at least a day in advance so that we can schedule you. These will be available Monday to Wednesdays from 10 to 1, and on Thursdays from 10 to 3, on from January 27th to February 25th, 2021. At this time, if warranted, and if a face-to-face consultation is necessary, we may need to refer you, or this will only be granted at the discretion of healthcare providers. And this is only after an initial virtual consultation. Be mindful that even though you're away from school physically, if you are ill, you may need to still report to your division, especially if there are assignments or tests that you may miss, and you may need to also still submit a medical from your physician, especially if that is needed for an extended period of time. And this is for exams as well as any tests. Be also mindful that the rule applies that if you are away from your online teaching for more than your online learning, for more than 4 weeks without informing the college, without a reasonable excuse, you could have been deemed to have unofficially withdrawn from your college program or your classes. So be sure that you are in keeping with what is required of you regarding your classes, and you should take a visit to the college website. So again, our contact information, I'm Kathy Rock, college nurse. My work email is kathy.rock@bcc.edu.bb. You can alternatively reach us at our extension. Mine is 5321. The college is PBS 4262858. And our colleague, our secretary, Miss Marian Bullen, MARIAN, .bullen@bcc.edu.bb. If you're going to make a telehealth appointment, then you need to send your email to bcctelehealth@bcctl.edu.bb. And closing, here's some resources should you need for review on the national and international sites or agencies that can assist you as you navigate COVID-19. Our national designated testing sites remain the Eunice Gibson Polyclinic, which is in Warren, so the Bradford Tate Polyclinic, which is in Black Rock, Winston Scott Polyclinic, which is next to Purity Bakeries and opposite the Queen Elizabeth Hospital, and the Best of Santos Public Health Laboratory. Our national COVID-19 hotline numbers remain COVID-19 536-4500, and our QEH COVID-19 help desk is 536-4800. For situational updates, for those of you who want to review a little bit more, remember the WHO is there, CARFA is there, Caribbean Public Health Authority, or agency rather. COVID-19 global cases can be tracked via the Johns Hopkins dashboard, which is there. Just some reminders about surface cleaning for common households. I mean, you can just use your bleach solutions. We have shared how you can reconstitute 1 gallon of bleach to about 1/3 a cup of water, or that suffice to a 1:9 ratio, 1 part bleach to 9 parts water, and 1/3 a cup is approximately, well, 78 mils of bleach to a gallon of water. And a gallon of water is about 3.785 liters, and you can reconstitute that, place it in a bottle, make sure you're labeling those bottles, and preferably not in a bottle that is used or have been used as a drink or food containers. Have it labeled and away from children and away from direct sunlight. Also do your test check to make sure that you can use bleach solutions on some surfaces, and definitely not those fabrics or color fast, or fabrics that are not color fast, or surfaces that are not color fast. Make sure that you're focusing on high touch areas around your home. Again, the doorknobs, the bathrooms, the hard surfaces, the sinks, those type of areas, the floors, obviously, to make sure that you are pretty much protecting yourself within your home environment as well. So here's some references if you care to follow up on this presentation. And there's a useful video, WHO Science in 5, which looks specifically at COVID-19 and its development. And this was published back in September 2020. So be mindful. This information is a presentation. It's strictly for educational and informational purposes. It's not intended to replace advice from your doctor or from your healthcare professional. Do not self-diagnose. Always consult a physician or healthcare professional regarding questions about your medical condition, health advice, and your health objective. We want you to remain safe. We want you to still enjoy all that there is to enjoy about college and your development, but we want you to do so safely. And again, if you have any queries, please let us know. I want to thank you all for listening, and please, let's do this together. Let's all keep safe. God bless you all. Bye-bye.